Hello, my name is Maria Lamarck, and I'm going to be discussing the aphasia from the POC. In the summary of the patient, their strengths, they have some auditory comprehension of spoken language within some areas of sounds, and they are startled with sounds and startled with light. They are able to follow the fingers and able to repeat single syllable words. However, their weaknesses are in other subject areas such as automated speech and singing, comprehension of single words, naming tasks, and so on. It appears that the patient has non-fluent aphasia, and we are predicting that the patient has global aphasia. So for a short-term goal with receptive language, one goal could be the client will identify, given a field of two options, common household items provided with multimodal prompts. So some items that the patient uses daily are a hairbrush or a toothbrush. Since they are very similar items, they seem to be very important to understand the difference between a hairbrush we use for our hair, the toothbrush that we use for our teeth. There's things that they use every day, but because the naming is very similar, it's very important for them to understand the difference between both. And if someone asks them for a hairbrush, that they are able to pick up the correct item. And for expressive, the patient will be able to provide variations of CV combinations, giving multimodal prompts and models with 50% accuracy. So I showed some examples here of some CV and CVC combinations. I did this in Spanish because I do have a client that does have this difficulty at the moment. And so the ability to produce every single consonant and vowel and consonant sound is very important instead of eliminating, shortening, and being able to actually produce the articulators correctly is very important. And so I put this as a short-term goal with about 50% accuracy because it is very difficult for individuals with global aphasia to be able to produce sounds appropriately. And this is a very appropriate goal for them.